Member for Prince George Mackenzie.
Thank you, Madam Chair, and thanks to the Minister. Appreciate that. I would like to get the follow-up afterwards. And I just want to maybe go back for my final question to another specific question about long-term care in rural BC in particular. And I appreciate the longer answer that the Minister gave to the last question about Northern Health as a whole. But really, there are 55% fewer publicly subsidized long-term care beds per 1,000 population that are over 65, and the median wait times to access these publicly subsidized long-term care beds is really twice as long in rural BC. So trying to see some improvements here, and I want to use Mackenzie as an example of this, and I really want to thank the Williston Lake Elder Society for the important work that they're doing to advocate for seniors' health care and housing in Mackenzie specifically. The latest census data in Mackenzie shows that there are about 1,150 residents over 55, and that's about a third of the population, and it's a growing number. A lot of seniors are moving to places like Mackenzie because of the affordable housing. So it's really a growing issue in some of these smaller communities. There are currently only 4 long-term care beds and 1 respite bed in Mackenzie, and it's just a challenging situation with a community that's 2 hours away from Prince George as the closest center. And I'm wondering if the government could explain a little bit more about for smaller rural communities, not just the Northern Health region as a whole, but smaller communities like Mackenzie, what the government is doing to provide more long-term care beds if possible and more respite opportunities.
Minister.
Thank you very much, Madam Chair, and thank you to the member for the question. Maybe a little bit of a joke, but I have to say, if the tables were turned and we were in the opposite seats, I would ask the exact same question. And the reason why, I think, is because of my life growing up mostly in rural communities, and in being the MLA for Mid-Island Pacific Rim, representing rural communities and being faced with these kinds of questions from my constituents all the time. So, for example, where I live on the west coast of Vancouver Island, there is no long-term care facility, and we have talked for years and years about a dream of having a long-term care facility that would enable people to stay on the west coast. And in particular, we've long talked about the dream of a facility that really serves and honors Indigenous elders. And it's very challenging for communities when very much loved members of our communities, especially small places where we're so well connected, and people need to leave to receive an appropriate level of care, and they have to do that by leaving the community. And myself personally have lost community members, people who are now living in places on the east coast of Vancouver Island or in Port Alberni, and it's really difficult. So for the community of Mackenzie, for example, I would imagine it's very much the same. It's a challenging thing to do. And it's important that we continue to do everything we can to invest in facilities in small towns. And I would point to Fort St. James, which I will admit I'm being envious of, because a town of about 1,300 people and has had a renewed long-term care facility with some beds added, and now has 18 beds there. And that's a fantastic and amazing thing for that community. In the meantime, as I've been speaking about in some of my previous answers, it is so important to support seniors, elders living in homes and being able to stay at home as long as possible. And I'm really glad that the member mentioned the Williston Lake Senior Society. I haven't had the privilege of meeting with them or meeting them yet, but I can imagine how tenacious they probably are, how deeply committed they are. And what they do is they represent one of the very best assets we have in rural communities, and that is people. That is the nonprofit sector, these community organizations that are driven to help people. And I recently was on Hornby Island and had a roundtable with the Hornby and Denman Island Community Health Society. And as I listened to them and the initiatives that they are undertaking to care for seniors in their community, where there's no long-term care facility there either, the way they are helping people who are leaving the hospital in Comox Valley and to return home, and the supports and their vision around, for example, purchasing a home or being bequeathed a home, I think, to be able to provide respite care for people who are caregivers living with seniors in their homes. It's really inspiring, and that's why supporting community-based senior services is a very important thing to do, and it's a priority of government, and that we are investing into. And I do want to talk about how community-based senior services for rural areas particularly are really integral to the plan to support seniors aging in place. And of course, they provide seniors with a very broad range of different supports, from non-medical home supports and health promotion programs and services that really address the social determinants of health, be it, for example, access to nutritious food, access to transportation or supports in enabling people to get out of home. And these kinds of services really demonstrated their value through the rapid rollout that took place during the COVID-19 pandemic of the Safe Seniors, Strong Communities program, and the support that that program and these organizations provide during climate emergencies, for example. So a modernized community-based senior services service delivery model is being implemented in phases, so that is work that's actively underway. And Better at Home is the flagship program that many people have heard of, the members familiar with, I believe, providing non-medical support to seniors. And there are 97 Better at Home programs in BC. What's also exciting about this as the program takes shape and develops in a more concrete way is the creation of 90-odd community collaboratives. So now bringing together these organizations to coordinate program delivery. So instead of one program here and there, that organizations come together and understand the services that each of them are delivering and can coordinate them in a much better and focused way. 45 of these community collaboratives were established in the last fiscal, 24-25, and there are more to come. And Mackenzie specifically, as part of a Mackenzie McBride Prince George collaborative, is being stood up. So that's on the list for implementation. And these collaboratives have a community connector position that supports each collaborative and helps to coordinate care for at-risk seniors in particular, to coordinate care with health authorities, to strengthen those partnerships within the community to really be able to deliver the best services possible. Budget 2024 is where you can find the funding line for that. That was $127 million over 3 years to modernize community-based senior support services and expand and improve services and stabilize the workforce. So I hope that gives a little bit of insight. I mean, we're going to continue, obviously, to invest in home health, continue to expand community-based senior services support. I hope to have a lot more to say on that relatively soon. But, in closing, I want to acknowledge the challenges that rural communities face with the economies of scale in having a full-blown long-term care facility. And that's why, it's an achievement for Fort St. James to have the facility that they do, and then to see facilities throughout the north. And it is difficult. The geographical distances in the north, they really provide, I think, the impetus for us all to think very creatively and innovatively, and to help build really strong, resilient communities where people support each other despite their political differences or their backgrounds. And we had a lot of very heartening stories during the pandemic, and we see it during climate disasters and emergencies, for example, of the way that people come together. And I know that in my riding, I'm incredibly inspired by the Denman and Hornby Island Community Health Society, and it sounds like the member is equally inspired by the Williston Seniors Group. And I appreciate the opportunity to be able to talk about this during estimates. Thank you very much, Madam Chair.